Welcome, and thank you for joining us during this special Facebook Live event as part of our Giving Tuesday campaign. My name is Colin Mulison, and I am Blank Park Zoo's Annual Fund and Membership Manager. Today, we will be taking you behind the scenes into our veterinary clinic to watch our vet team perform a routine examination on one of our wallabies. We will get to hear from our veterinarians and wallaby keepers, and we will be answering some of your questions live, so be sure to put them in the comments below. This live event is part of our Giving Tuesday campaign, where we are hoping to raise $15,000 to cover the costs of a new anesthetic monitoring system for our veterinary clinic, which is of the utmost importance for safe and successful procedures. Today, we will be taking you into the procedure room to watch live with our veterinary staff. We are so close to our goal, and we hope you will help us reach it by donating to the Facebook campaign tagged in this post, or by visiting blankparkzoo.com/givingtuesday. We are now going to go live into our vet clinic, and I will turn it over to Michaela, our marketing coordinator, who will take it from here.
Hello everyone, and we are live just like that. My name is Michaela Danke, and I am so excited to be joining you guys today live for a Wallaby examination. I'm joined here in the room by several incredible people, so I wanted to give introductions real quick. We are joined by staff veterinarians. We have Dr. Gall as well as Dr. Nick in the background, and we are also happy to have our veterinary technicians, Chris as well as Emma, joined by and assisting with Chelsea. And we also have in the room our small mammals supervisor, Alex, and she's going to be answering your questions live with us today. So without further ado, just to set kind of the set for you guys, we're excited to have you. This is a continuation of our Giving Tuesday campaign, which we have been doing all this week, so across all of our platforms. So that includes Facebook, that includes Instagram, as well as blankparkzoo.com and blankparkzoo.com/givingtuesday. All of those donations have been streaming into our Giving Tuesday fundraiser. And what we are fundraising for this year is veterinary equipment. So that includes surgical lights, as well as an anesthetic monitoring device. And we're going to learn more about all of those things today, as well as tap into some of the information that Alex has about wallabies. So we'll be answering those questions live. We have Colin in the background able to respond to those, as well as many that we can get to today. So please be putting your questions in the comments. And again, if you want to donate, we are so close to our fundraising goal. We're actually just a couple $1,000s short. So visit blankparkzoo.com/givingtuesday. Help us reach our goal. We're floating around 88%, so we're really excited to hopefully get there today. So I'm going to start you guys off with Dr. Gall, and he's going to talk to us today about what we're seeing right now and what we can expect from the rest of this procedure.
Today, you know, one of the big things that here in the veterinary department is we pride ourselves on the really good medicine that we perform, and so super excited for you guys to join us. What we're doing today is just an annual exam on a wallaby. So all of our wallabies get an annual exam. So once a year they come into our care and we do full physical exams. So right now, what you're looking at is, this is one of our female wallabies. She currently is getting examined by Dr. Nick. So part of some of the things that we look at during an annual exam is their eyes, their ears, their teeth specifically. So wallabies are a species or a taxa that has dental disease. So dental disease is one of the main diseases that wallabies can have throughout their life, and so we pay, you know, extra or special attention to their teeth and making sure their teeth are healthy. So same thing as what we would do, you know, going to the dentist twice a year. These guys basically go to us once a year to get their teeth cleaned. Some of the other things we do is just a broad physical exam, so making sure that their heart sounds appropriate, that their lung fields are listened to and sound appropriate, and that they don't have underlying diseases like pneumonia or a cough or, you know, other things that might affect their breathing capabilities.
So in continuing our Giving Tuesday campaign, what we're fundraising for right now is, of course, the anesthetic monitoring device as well as the surgical lights. How is that incorporated into your guys' daily life at the zoo?
Sure, great question, and we appreciate everybody that's donated up to this point. So as you can see with this Wallaby, part of the process of performing these wellness exams on them is having to anesthetize them, and basically that's a fancy word for injecting them with some drugs that kind of put them in a state of comatose that allows us as staff to be able to safely evaluate them, as well as it keeps them safe as well. But part of that process is some of these drugs that we administer in order to keep them safe and us safe, alters some of their physiological values. So it can alter their heart rate, their respiratory rate, some of their oxygenation or CO2 levels as well. And so what we're asking with this giving campaign is just updating our anesthetic monitoring equipment. So basically it's equipment that we place onto either the tubes that are associated with this procedure or even directly on the animals to help monitor those specific values. And although we do have what we consider Band-Aid machines right now that they give us some of these values, but don't unfortunately give us all of the values that are to the level that we expect kind of out of our medicine program here at Blank Park Zoo and about the care that we want to give these animals. And so, upgrading some of this equipment is ideal for us to be able to provide that, including our surgical lights. So as you might notice in this room, we do have one surgical light that's functional. Our other one isn't, and then as well in our surgery room, we had 2 lights in there that both went out over the past year as well. And so all of those things contribute to how well we can do our exams, and so obviously lights are very important, especially when we only are able to get hands on these animals once a year. And so it's really taking the time and effort and utilizing those specific moments to do as thorough a job as examining them as we can. And so all of those things are extremely important whenever an animal is on the table for us being able to evaluate them.
Absolutely. And just because you're seeing these animals once a year, that doesn't mean that you have any shortage of exams throughout the day. So you see a number of species through this room every single day. So that is any size of animal, from
Correct.
The smallest of wallabies to the largest of lions. So this equipment is utilized heavily in our daily life here. So
correct. And one of the main questions we get is, what's a typical day look like for a zoo veterinarian? And I laugh at the answer, at the question, because there isn't an answer. Every day's different. And that's, I think, what I enjoy most about this job is you can go from looking at a ferret to a rhino to a wallaby one day, and then go to a giraffe, a frog, and a fish the next. And so, we utilize this equipment for all of those species. So, extremely, extremely important for every day that we work here.
that's incredible. Awesome. So while we also have her in the room, I am going to bring in our small mammal supervisor. This is Alex. She has been a supervisor for over a year now, right?
Actually 6 months, but I've been here at the zoo for about 5.
Awesome. So she said she's been in the supervisor role for a number. Oh, she's been in the supervisor role for about 6 months, but she has been at the zoo a lot longer. So right now I want to discuss the wallaby that we are seeing on the table right now. What is her name?
Her name is Rosella, and she is one of our female Bennett's wallabies. These guys are also known as Kings Island wallabies or redneck wallabies.
And we actually had a wonderful question on Instagram from Macy. She asked us, how many wallabies do we have here at Blank Park Zoo?
So we currently have 21 individuals in our mobs. We have 2 mobs. We have a family mob and a male mob. And I guess a fun fact that a group of wallabies is called a mob.
And we do have one of the largest mobs in North America.
Actually, and it's actually really nice. Val, who works up in our commissary department, is actually our SSP coordinator for the Bennett's Wallaby program. So she is actually on site, and she is the one who's in charge of moving wallabies in and out. So we do have one of the largest mobs in the country.
That's incredible. And SSP is a species survival program. We participate in a number of them throughout the zoo, and the Bennett's Wallabies are one of those. So we had another question. Why are there two mobs? Or it seems like there's wallabies in two places throughout the zoo.
So if anybody has ever come to the zoo, you might have noticed that we have two groups of wallabies in our Australia walkthrough exhibit and also our island exhibit that if you've taken a train ride, you've probably seen the wallabies out there as well. The main family mob is what we call the family mob, is comprised of our breeding females, our breeder male, and then any offspring that they may have. So if you've been to the walkthrough exhibit recently, you've probably noticed them jumping around. It's a very interactive exhibit. So right now we have 14 individuals over in that mob. We have still all of our breeding females and a couple of juvenile adults, which were our joeys from about 2 years ago. And then the island exhibit is our male mob, and we like to call it our bachelor mob because it's all males. So those are our non-breeding males, or just males that aren't recommended for breeding.
And then obviously this is in our Australia walkabout. So what part of the world are wallabies from?
They are from the continent of Australia, but they are also found in other areas like Papua New Guinea as well.
And what is their habitat like that they have in the wild?
So they are mainly found kind of like in the rock and brushy area. So one thing that people like to compare wallabies to is kangaroos, which that's common. They look very similar. The main difference between kangaroos and wallabies is obviously the size. Kangaroos are much, much larger. So these guys typically only get to about roughly between 20 to 50 pounds, whereas kangaroos can get up to anywhere between like 200 to 300 pounds. They're huge. And obviously the size factor as well. These guys can get 2 to 3 feet tall, whereas kangaroos can get up to 8 feet tall. So when you're in Australia and you're kind of like in the open prairie areas, that's where you will find the kangaroos, whereas the wallabies tend to go in the more forested, shrubby areas.
Awesome. And what do the wallabies tend to eat? What does their diet look like, both in the wild and here at the zoo?
So they are herbivores, meaning they primarily eat vegetation and brush. So here at the zoo, another thing that you've probably seen the wallabies do in the walkthrough exhibit is grazing. Their entire exhibit is grass, creeping Charlie, and they'll just kind of nibble on that throughout the day. Inside their barn, we do provide them with hanging hay feeders, which are filled with Timothy grass hay. And then we also provide them a diet called Missouri macropod, which is essentially just a grain that has all their nutrients, vitamins, and minerals and everything that they would need. And then occasionally we do give them dietary enrichment. So these guys are huge fans of peanuts. We like to throw them into the stalls with them in shell, and they'll use their teeth. Kind of like Dr. Gall mentioned before, they have some incisors in the front of their mouth that they will use to crack open the shells and get the tasty peanut inside. So that's definitely one of their favorite treats.
Awesome. So going off of diets, what does a routine day in the life of a wallaby keeper look like? What do you guys do with them?
So the first thing that we do when we go in the barn is essentially we turn on all the lights and wake them up for the day. We like to get eyes on all the wallabies, make sure that they're all healthy, make sure they're all accounted for. And then once we kind of get all of our morning checks done, we start to shift them out onto the exhibit. One thing that we do before shifting them out is that we just check the integrity of the perimeter fence, make sure there's no breaks in the fence, make sure there's no trees that have fallen overnight. And once that is secure, we will give them some water outside so they have access to water, and then we will shift them out for the day essentially. So, yeah.
And we had a really good question on Instagram from Brianna. So she was wondering what some of the wallabies' favorite things to do are, and we could also incorporate, what does their enrichment look like?
Absolutely. So these guys, like I said, are grazers. So more often than not, you will see them when the weather is nice out on exhibit grazing. That's something that they do all day, every day. If it's a super sunny, warm day out, they do like to sunbathe. So occasionally you might see them laying on their side, kind of soaking up the sun rays. What was the second part of that question?
Some of the enrichment. What is the enrichment?
Yes. So, like I said, we do offer them a variety of dietary enrichment items. One of my favorite enrichment items to give is hanging burlap sacks filled with hay, especially for our male mob. They like to play fight with it. So, I don't know if anybody's ever seen our males. Our males typically do it more than our females, but they will often kind of face each other and kind of play fight, and they'll use their tails and they'll use their feet. So the burlap sack kind of mimics that, and it's something for them to kind of play with and manipulate around. But we do offer them enrichment every single day, and then at least 3 times a week, we like to offer them browse, which browse is essentially just tree clippings like honeysuckle or mulberry, and they love to strip the bark and eat the leaves off of it. So that's also another favorite treat of theirs.
That's awesome. And that's one thing, Colin, that we should put in the comments too, is our browse program. We have an upcycle. You can't imagine how much browse we go through in a single day, because almost every species of animal can get that here at the zoo. So yeah, we'll put a comment in there about it so you guys can check it out. Another question from Instagram that we had was from Jacqueline, and she wanted to know if wallabies are affectionate towards their human caretakers and each other.
So yeah, they are definitely affectionate towards each other. We do have a couple of males that kind of have like a pair bond with each other. More often than not, you'll see them play fighting or just kind of grooming each other. We do have 2 males that are pretty close. Their names are Bilbo and Peabody. More often than not, you'll see Bilbo grooming Peabody's face, which is super sweet. Peabody is also super affectionate towards keepers. He's just a super cuddly, nice wallaby. He loves to be hand-fed. He loves to kind of come up and give you some sniffs when you're shifting them in the morning. So, and then on our family mob side, like I said, we have our breeding females and any of their offspring. So currently in our family mob, we do have some mothers and their either daughters or sons. So Rosella on the table is actually a mother, and her son's name is Echo. And so more often than not, you'll see them hanging around each other and kind of grooming and whatnot.
So then to end this, we wanted to talk about wallabies have an extremely fascinating reproductive cycle. So what does that look like for wallabies?
So these guys are marsupials, meaning that they have a pouch where their young will develop. So essentially when a wallaby becomes pregnant, their joey will develop inside for about 21 to 30 days. And then within that time frame, they will actually be quote unquote born, and then they will crawl up into the pouch themselves and latch onto a teat inside of her pouch. So the cool thing about marsupials is that they can have embryonic diapause, which also means that they can be in 3 separate stages of reproduction at the same time. So they can have a joey that is out of the pouch. He may come back every once in a while and nurse from one of the teats. She can have a joey in the pouch that is attached to the other teat. And then she can also have a fertilized egg. That's essentially what the embryonic diapause is. A fertilized egg kind of just paused and ready to go whenever the next joey comes out of the pouch. And the cool thing about wallaby milk production is that she can have 2 separate types of milk for depending on which joey is nursing. So these guys are very cool, very fascinating. Typically when we have a breeder male with the females, we always plan for 2 babies and not 1 because, again, going back to the embryonic diapause, it's just something that's fascinating and super cool. So.
That's incredible. And our staff is just exceptional with caring for not only the wallabies, but all of the animals here on site. So if you have any questions for Alex, we'll probably have her hang around and answer questions at the end of the live as well. So feel free to be putting anything in the comments. We'll see them as well as Colin back here answering. And we're actually going to see Dr. Gall. Do you think we'd have an opportunity to potentially look into a pouch today? Awesome. All right.
Let's see. So Nick, I don't know if you can get in here and see this. So it's actually just a very cool thing if you've never seen it before. So they have 4 teats in there. And like Alex was explaining, as soon as a joey latches onto that teat, they'll remain on there for the majority of their neonate life, where they get nutrients and stay nice and warm in here. So she hasn't had a joey in a little while, so her pouch is kind of dirty, but not necessarily an indication of good health or bad health. Just sometimes when they don't have joeys for a period of time, they can get some just debris, just dead skin that flakes off and remains in there. But definitely one of their cool structures that I always enjoy peeking into and peeking at, just to assess if they do have a joey or not.
And then, Dr. Gall, we had a good question on Facebook from Vania. She's asking, how do you actually go about cleaning their teeth? What does that look like?
Sure, so that's something similar to like you would see in your dogs and cats as far as a routine thing. So scaling and polishing, trying to get off that callus and plaque that can sometimes reside on their teeth. The challenging thing about this species, though, is they have a very small mouth, and so it's tedious and sometimes troublesome to get all the way back to their far teeth, so their premolars and molars. But we have a variety of tools that help with that. And so an ultrasonic scaler is what we currently have, which sometimes human dentists use those things too, but it's fairly common in your small animal, cat and dog practice as well.
Awesome. And did we get to take a look at their tail at all? Because that's one of the fascinating parts of their anatomy.
Yeah, definitely. So their tail tends to be very robust and thick and muscular. Again, one of their primary features that helps with locomotion as far as balance. The other thing they'll do sometimes is sit on it as well, so it'll help keep them sitting upright. The other thing that I feel like is extremely fascinating with any macropod species, so wallabies, kangaroos, are their feet. And sometimes you wouldn't necessarily expect to see this specific kind of anatomy on a kangaroo. So their front or their forelimb, hands or paws, are much, much different than their hind limb. And so I think this contrast is surprising, especially to those that don't get to look at wallabies up close or personal. So that's the front, and then these are the back. So very different, but equally as fascinating and cool, that again help them propel and jump and get around like they do. Very muscular back legs. So some of the other things that Dr. Nick did today was just do a full body assessment, making sure there's no lumps or bumps, checking her skin, making sure there's no sores or abrasions or wounds. They palpate the abdomen to make sure there's no masses in there, try and feel the kidneys, the spleen, the liver, all of our internal organs to try and do a best assessment as we can. She'll get some vaccines today as well for preventative measures, as well as we placed a venous catheter, so giving us the ability to give intravenous fluids to try and help get rid of some of those drugs that we administered eventually, as well as just safety. So there's pros and cons to anesthesia, and one of those things is that sometimes emergencies do happen under anesthesia, and so having access to that is essential as well. One of the other things that we did today earlier before we jumped on is we were able to shoot some radiographs, and so I wanted to show you guys these as well. So this is some of the other diagnostics that we perform on a routine basis, is internal assessments as best we can. So this is just a radiograph of her thoracic cavity, so assessing her lungs, and those look good, as well as her heart. And then anything else as far as bony structure that's within this images. So making sure her spine looks okay, her forelimbs look all right. We'll continue these radiographs and take a few of her head, specifically her teeth. So like I mentioned before, dental disease is a big one. So radiographic evaluations of those teeth are equally important, as well as further back. So we'll take more of her abdomen, her knees. So one of the things that we see, as well as dental disease here at the zoo, not only in this species, but in general, is animals in our care live a lot longer than they do in the wild. And so with that lengthy time of being alive comes ailments that are associated with being older in age. So just like you and I, or our grandparents as well, arthritis is a big one that we can see radiographically, and that's as that progresses, it can become painful. So a lot of what we do here in our geriatric animals is pain control for some bony changes that we see. So in these radiographs, as we go farther back in their body, being able to assess their knees and their ankles, and making sure that there aren't any specific changes in those areas that we can address, or that we can help continue to keep them comfortable while they're in our care.
And lumpy jaw is a wallaby disease that you're often very aware of and try to be conscious of as well, right?
Correct, yeah, and that's just a common name for dental disease. So a lot of the times you can get teeth that then have abscesses or small infections in them. Then it can change kind of the shape of the mandible, and so that's kind of where the common term of lumpy jaw. So when you run your hands through their jaw, it kind of feels bumpy. But yes, again, it's just a common term for the dental disease that they can have.
Gotcha. So how did this examination go? How does she check out?
Sure, I think for what Nick's seen today is we've been good. She's definitely a healthy wallaby, which is great. We'll continue to do radiographic assessments as we progress here, just to confirm our suspicions of just looking at her looks okay. But again, we've collected blood today as well, so that'll get sent out. We'll review those values as they come in tomorrow, and then give her hopefully a clean bill of health.
Awesome. Well, I think I agree with everyone that this was absolutely incredible. I think we had one last question come through on Facebook. So, this is a great question from Kathy. So it's about their conservation status in the wild. Do we know much about wallabies?
Yes, so their conservation status right now is least threatened. Like I had mentioned before, they are part of an SSP program, a species survival program. So kind of just going along with those recommendations of when and how often we need to be breeding. I know a while back when the Australia wildfires were happening, it definitely decimated part of their population. So that's something that, we're aware of. But as for right now, they are at least concerned in the wild.
Awesome. Perfect. Well, join me in thanking everybody in this room today. We wanted to thank Dr. Gall, Dr. Nick, as well as our vet techs. They're going to continue wrapping up this procedure. We'll probably do a follow-up on the examination on Facebook and let you guys know how everything went. We just wanted to take the time again to thank all of you. This is a really special occasion for us. Giving Tuesday is a time that we're incredibly grateful for all of our supporters in our community. Again, if you feel so inclined to donate, we're doing that across all of our platforms right now. So whether you find yourself on Facebook, on Instagram, we are taking donations from our website as well as blankparkzoo.com/Giving Tuesday. You can check our progress. I know we're incredibly close to reaching our goals. So again, thank you so much for all of your time, and we're going to wrap this up.